Good afternoon, and welcome to our second live update of this semester. It has been so great to see our students, staff, and faculty these first few weeks of the semester. Today is a beautiful day. There's so many students outside. I've been out every day this week interacting with students, and one of the things I can tell you is they are so happy to be here. They're so excited to be back in the classroom with face-to-face classroom experiences. I want to thank everyone for wearing their mask indoors, which we are having to do because the numbers are still high. And I encourage everyone to also get vaccinated. So let me give you a COVID update. That's kind of what we're going to focus on today. I want to remind you that you can find the latest data on our active COVID cases and on those who've reached out to the COVID support team on our website, and that is utk.edu/coronavirus. We have returned 2 weeks ago. I told you we were going to update this weekly. We have switched to updating it daily. So as of the end of the day yesterday, we had 256 active positive cases. 256. 26 of those are employees and 230 are students. Now that is, the numbers have risen since 2 weeks ago when I was here talking with you. In the last 2 days ago, the number was 267. Last night it was 256. So I'm hoping that we've, peaked and maybe are going to start the decline, but we'll keep watching for it. But that's the data on our cases. Cases clearly are rising in the community, and as I've said, the last 2 weeks, as we expected, when students returned to school, we would have a higher number of cases, obviously, than we had before. But just like in the community, our Student Health Center is seeing an increase in students needing testing and care. While most of the cases that Dr. Gregg and his staff have seen have been mild, the surge caused by the Delta variant is serious, and I want to encourage everyone to hear that. It is serious, and it is certainly straining our healthcare system. Our local hospitals, including UT Medical Center, right across the way, have brought in reinforcements through the National Guard to help manage the influx of cases. That's pretty serious. They've brought in the National Guard to help manage all these cases. Hospitalizations are not only rising, but patients are skewing younger than at any point in this pandemic. And according to data from the Tennessee Department of Health, nearly all of the hospitalizations are among unvaccinated patients. So let's talk for a minute again about the different measures there are. We know that vaccines are safe, they're free, they're effective. The FDA has now started granting full approval to COVID vaccines, beginning with the Pfizer vaccine. So that, as everyone knows, was recently fully approved. If you've not already gotten vaccinated, this is the time to do so. We have appointments at the health center that are available to anyone who wants. It's free, it's available, and we encourage you to consider that. We are grateful that the vaccine rates are going up, both across our state and here on campus, according to the indicators that we have. So we feel good about that. That's a good sign. This is really great news, and we're so appreciative of those of you who've already made the decision to protect yourself and others. Thank you also for wearing your mask. Please continue to follow our mask policy while indoors. You can find out more about vaccines and what to do if you are sick and when and how to access the COVID support teams at the Student Health Center website. And here's how that is. Student Health, all lowercase, studenthealth.utk.edu. studenthealth.utk.edu. This is all we were going to focus on for today's update. I know everyone is excited about the kickoffs of the football season just in a few hours. We encourage people in Neyland Stadium to take precautions like masking up. There will be masks available. please continue to be smart, wear your mask, get your vaccine, and look out for one another. We'll be back doing this live update again about COVID and where we stand on our campus in 2 weeks. So to everyone, have a great day and go Vols.